Hi, I'm Dr. Joel Hein. The phrase torn ACL is a commonly talked about injury among athletes, parents, and active adults. The ACL is one of the most commonly injured ligaments in the knee, and because of this, ACL reconstruction is one of the most talked about and debated topics in orthopedics, as there are many options for reconstruction. Let's quickly go over what the ACL is. The anterior cruciate ligament, or ACL, is one of 4 ligaments in the knee. It crosses diagonally through the knee joint and helps prevent the shin bone, or tibia, from moving forward relative to the thigh bone, or femur. It also plays a crucial role in providing rotational knee stability, for example, when you pivot or change directions quickly. When you tear your ACL, an orthopedic surgeon will look at many factors to determine if surgery is necessary. This includes your age, your activity level, as we often recommend surgery for competitive athletes, active adults, or those who have jobs that require pivoting or heavy manual work, your functional stability, and associated injuries. If surgery is determined to be the best treatment option, there are many choices to make when it comes to reconstruction. The first decision that needs to be made is whether to use your own tissue, known as autograft, versus donor tissue from a cadaver, known as allograft. This decision is also based on your age, activity level, and associated injuries. For some patients, the thought of having cadaver tissue in their body is not an option, and an autograft is chosen. The advantages of autografts include decreased cost, no risk of disease transmission, and possible faster incorporation or healing time. The main disadvantage is the need for the harvest procedure to obtain the graft, leading to a longer surgery and potentially increased pain. The advantages of an allograft is the lack of a harvest procedure, which can lessen the pain associated with surgery and certainly decrease the time spent in the operating room. One disadvantage to allograft tissue is the potential risk of disease transmission, yet this is a relatively low risk of 1 in 1.6 million. The biggest concern, however, is the higher incidence of graft failure when compared to autograft. Let's talk about a few of the most commonly used grafts when it comes to ACL reconstruction. In this type of autograft, we use a portion of the patellar tendon, which connects the kneecap or patella to the shin bone or tibia. The central 1/3 of the tendon is removed, along with a bone block from both the patella and tibia. Historically, this has been the most commonly used autograft and is felt to incorporate or heal the fastest. However, there are disadvantages to this graft. The potential side effects of using a patellar tendon autograft include postoperative anterior knee pain, a large incision, pain with kneeling, and risk of postoperative patella fracture or patellar tendon tear. Another autograft option includes the use of 1 or 2 of your hamstring tendons, specifically the semitendinosus and gracilis. Unlike the bone patellar tendon bone graft, this harvest does not require the removal of bone, but only the tendons themselves. While the size of a patellar tendon graft is predictable, it is often difficult to predict the length and quality of the hamstring tendons. Rarely, the hamstring tendons are not large enough and have to be supplemented with allograft. The potential advantages of the hamstring autograft include less anterior knee pain, a smaller incision, less postoperative pain, and reduced risk of postoperative stiffness. There are many options when it comes to allograft tissue. In addition to allograft bone, patellar tendon bone, and hamstrings, other popular options include the Achilles tendon or the anterior tibialis tendon. The decision of which allograft to use typically comes down to surgeon preference and graft availability. While there are no real advantages of one graft over the other, the advantages of an allograft include decreased operative time, smaller incisions, and often less postoperative pain. These grafts are typically reserved for older patients participating in lower demand sports, patients who may need multiple ligaments reconstructed, and those patients undergoing revision or repeat ACL reconstruction.